Alright, this is Stephanie Huff. I'm redoing the first little part of the diabetic lecture, just due to having some difficulties with some sound. Alright, so this will be a first short segment of diabetes. Alright, so an overview of diabetes mellitus. This is a disorder of hyperglycemia that results from defects in insulin secretion, insulin action, or both. This leads to abnormalities in carbohydrate metabolisms, proteins, and fats. There are 4 major types of diabetes. Type 1 diabetics accounts for 5 to 10% of the total cases of diagnosed diabetic cases. Type 2 accounts for 90 to 95% of the diagnosed cases. The third type is gestational diabetes, which is 2 to 5% of all pregnancies. And then there's other specific types. This is 1 to 2% of all diagnosed cases. Looking at the role of hormones, there are a group of cells in the islets of Langerhans that produce the hormones. The islets have 3 different types of cells. The endocrine part of the pancreas produces these hormones that are necessary for metabolism and cellular utilization of carbohydrates, proteins, and fats. First type of cells is the alpha cells of the islets. They produce glucagon, which stimulates the breakdown of glycogen in the liver, the formation of carbohydrates in the liver, and breakdown of lipids in both liver and adipose tissue. Primary function of glucagon is to decrease glucose oxidation and increase blood glucose levels. Beta cells secrete insulin, which facilitates the movement of glucose across the cell membranes into the cells, thus decreasing blood glucose levels. Insulin is regulated by blood glucose. It will increase when blood glucose levels increase and decreases when blood glucose levels decrease. When you eat food, insulin levels begin to rise in minutes, peaks within 30 to 60 minutes, and returns to baseline within 2 to 3 hours after the meal. Delta cells is the third type of cells in the islets of Langerhans, and they produce somatostatin. It is believed to be a neurotransmitter that inhibits the production of both glucose and insulin. Looking at blood glucose homeostasis, all body tissues and organs require constant supply of glucose. However, not all tissues require insulin for glucose uptake. Example, the brain, liver, intestines, and renal tubules don't require insulin to transfer glucose into their cells. Skeletal muscles, cardiac muscles, and adipose tissues do require insulin for glucose movement into the cells. Normal blood glucose in healthy clients is regulated by the actions of insulin and glucagon. And so this is where we pick up on part 2, showing you the normal insulin secretion during meals.